Hi and Assalamualaikum everyone. Today, we are going to explain about infertility. Our group member consists of 4 members, Nur Laila Najwa binti Hazizan, Nur Farina binti Nur Azhar, Nur Shahira binti Zulkifli, and Mariam Darwisha binti Zaidi.
Let me introduce you. What is the infertility? Okay, infertility is a disease of the male or female reproductive system defined by the failure to achieve a pregnancy after 12 months or more of regular unprotected sexual intercourse. Infertility affects millions of people and has an impact on their families and communities. Estimates suggest that approximately 1 in every 6 people of reproductive age worldwide experience infertility in their lifetime. So, as you can see, this problem is not a small thing that you can take it slightly. Does Malaysia have this infertility issue? World Health Organization (WHO) estimates that 1 in 6 people are affected by infertility. This problem same as in Malaysia. The current population fertility rate of Malaysia is 1.7637 births per woman, a negative 0.6% decrease from 2023, when the fertility rate was 1.7743 births per woman. In the future, Malaysia fertility rate is projected to decrease to 1.6547 children born per woman by the year 2100, a total decrease in the fertility rate of Malaysia by negative 6.18% from today's standard. So, what is the factors that lead to infertility problems? Here is the graph about fertility in Malaysia. As you can see, this graph decreases year by year. One of the factors for the fertility decrease is people in Malaysia have infertility problems.
Next, let's jump to factors that lead to infertility problems. Research consistently shows that lifestyle factors, what you eat, how well you sleep, where you live, and other behaviors have profound effects on health and disease. Fertility is no exception. A number of lifestyle factors affect fertility in women, in men, or in both. These include but are not limited to nutrition, weight and exercise, physical and psychological stress, environmental and occupational exposures, substance and drug use and abuse, and medications. These are the factors for men. First, obesity is linked to lower sperm count and quality in men. Next, strenuous physical labor and taking multiple medications are known to reduce sperm count in males. Using bodybuilding medications or androgens also can affect sperm formation. Men could also be infertile by having high blood pressure, as it could change the shape of sperm. As for women, being underweight is linked to ovarian dysfunction and infertility in them. Excessive exercise also is known to affect ovulation and fertility in women. Apart from that, substance use, including smoking tobacco, using other tobacco products, marijuana use, heavy drinking and using illegal drugs such as heroin and cocaine, could reduce fertility. Besides that, radiation therapy and chemotherapy could also cause infertility. Last but not least, some chemical like EDC methylparaben could affect fertility in women. To solve this problem, the treatment that we chose is IVF, that stands for in vitro fertilization. In vitro fertilization is a process of fertilization where an egg is combined with sperm in vitro. The process involves monitoring and stimulating a woman's ovulatory process, removing an ovum or ova from the ovaries, and letting a man's sperm fertilize them in the culture medium in a laboratory. IVF is an option if you or your partner has these conditions below: blocked or damaged fallopian tubes, endometriosis, low sperm count or other sperm impairments, polycystic ovary syndrome, PCOS or other ovarian conditions, uterine fibroids, problems with your uterus, risk of passing on a genetic disease or disorder, unexplained infertility, and are using an egg donor or a gestational surrogate.
fertility rate per woman aged 15 until 49 years for IVF. This graph shows that 2012 is the highest rate, which is 2.2. 2022 is the lowest, 1.6. 2013 is 2. 2014 is 2.1. 2015 is 2. 2016 is 1.9, same as 2017. 2018, 2019, 2020 is 1.8. Last but not least is 2021 is 1.7. In vitro fertilization IVF is a complex series of procedures used to help with fertility or prevent genetic problem and assist with the conception of a child. Here are the general steps involved in the IVF process. First, ovarian stimulation. The patient takes fertility medication to stimulate the ovaries to produce multiple eggs. During this period, the patient hormone level and ovarian response are monitored through blood tests and ultrasounds. Second, egg retrieval. Once the eggs are matured, they are retrieved from the ovaries through a minor surgical procedure called follicular aspiration. This is typically done under sedation using a thin needle inserted through the vacuolar wall. Sperm collection. A sperm sample is collected from the partner or a donor. The sperm is then processed to isolate the healthiest and most active sperm. Next, fertilization. The retrieved eggs are mixed with sperm in a laboratory dish to facilitate fertilization. In some cases, ultracytoplasmic sperm injection (ICSI) may be used, where a single sperm is directly injected into an egg. Besides that, embryo culture. The fertilized embryos are monitored for several days as they grow and develop in the lab. Typically, they are observed for 3 to 5 days to reach the blastocyst stage. The next one is embryo transfer. One or more healthy embryos are selected and transferred into the patient uterus. This is done using a thin catheter inserted through the cervix. Number 7 is luteal phase support. After the transfer, the patient may receive hormone treatment such as progesterone to support the uterine lining and improve the changes of embryo implantation. Last but not least is pregnancy test. About 10 until 40 days after the embryo transfer, a blood test is performed to check for pregnancy. If the test is positive, further monitoring and ultrasounds will be scheduled to confirm and follow up on the pregnancy. This is a video to show IVF step by step, more detail. For Quran verses, this fertilization be done with husband's sperm. It is not permissible to use the sperm of anyone but the husband for this fertilization, because Allah says, interpretation of the meaning.
والله جعل لكم من أنفسكم أزواجا وجعل لكم من أزواجكم بنين وحفدة حفدة ورزقكم من الطيبات أفبالباطل يؤمنون وبنعمة الله هم يكفرون.
And translation for Surah An-Nahl, verse 72, 460. And Allah has made for you from yourself mates, and has made for you from your maid sons and grandchildren, and has provided for you from the good things. Then, in falsehood do they believe, and in the favor of Allah they disbelieve. So, I want to explain about the fatwa regarding the treatment taken. However, IVF may be permissible subject to certain conditions, including the following. First, the woman's eggs and male sperm should not decay in a freezer for later use or another appointment, and there should not be any delay in placing them in the woman's uterus. Rather, that should be done immediately without any delay. Let them be mixed with others or be used for other people. For the second condition for allowing IVF is the sperm must come from the husband and the egg from the wife and be implanted in the wife's uterus. Anything else is not permissible at all. The third condition for allowing IVF is there should be complete trust in the doctors who are doing this procedure. And the fourth is a delay of 1 or 2 years in having children is not an excuse for the couple to pursue these or similar methods. Rather, they should be patient, for Allah may grant them a way out soon without them doing anything that is haram.
Now, how to increase fertility? Certain nutrition and lifestyle strategies like eating fewer refined carbs and getting moderate exercise may help increase fertility. There are few natural approaches that may help increase fertility. Here are some of natural strategies that may help boost fertility. First, reconsider your protein sources. A 2019 study suggests that following a Mediterranean-style diet may improve fertility. These types of diet are generally higher in fish and lower in red and processed meats. A study found that higher fish consumption was linked to a higher rate of live birth. Second, prioritize omega-3 fatty acid. Eating healthy fats every day is important for boosting fertility and overall health. Omega-3 fatty acid may be particularly beneficial for increasing fertility. You can find this healthy fat in many foods such as chia seeds and walnuts. Third, pay attention to fiber. Research from 2020 found that a diet higher in fiber and lower in added sugar may slightly increase female fertility. Some examples of higher fiber foods are whole grains, fruits, vegetables, and beans. 4. Get active. Exercise has many health benefits, including increased fertility. Increasing moderate physical activity has positive effect on both female and male fertility, especially for those with obesity. Excessive with high intensity exercise may have a negative effect on female fertility for some people. Talk with a healthcare professional to determine which type of exercise would be most beneficial for you.